In order to understand osteoporosis, you need to have a general concept about bone remodeling. If you know nothing about bone remodeling and want a detailed explanation, then I already have a video uploaded on it in the same playlist. But if you are lazy to check that out, you can continue with this video because I'll be summarizing the same points here as well and then connecting the link between bone remodeling and osteoporosis. So let's begin. Your bone, it's a dynamic structure. That is, it is continuously going through the process of breakdown and formation. Old bones, old matrix of your bone get broken down and then it gets replaced by the formation of new bone. And this whole process of breaking down of bone and the formation of new bone is what we call bone remodeling. Under bone remodeling, there are two steps that you need to know. Where the first step is the breakdown of old bone, which is brought about by osteoclast, and the type of activity is osteoclastic activity. Following that is the formation of new bone, which is brought about by osteoblast, and the type of activity is osteoblastic activity. So there's your osteoclastic activity where old parts of bone get broken down or eaten up by osteoclast. And then there's your osteoblastic activity where the eaten up part gets replaced by the formation of new bones by osteoblast. Physiologically, that is in case of a normal bone, the osteoblastic activity balances osteoclastic activity. As a result, the mass of the bone does not decrease. That is, the formation of new bone balances the breakdown of old bone. But due to certain condition, due to certain reason, factor, if osteoclastic activity becomes greater than osteoblastic activity, that is, the breakdown of bone becomes greater than the formation of bone, then the bone would obviously thin out or the mass of the bone would decrease. However, normally that does not happen. That's a pathological condition. Bone remodeling is dependent on serum calcium level. For example, if in your blood the level of calcium is more than normal, it triggers the parafollicular cells of your thyroid gland to produce thyroid calcitonin. Thyroid calcitonin promotes osteoblastic activity, that is, the activity of formation of bone. And for formation of bone, you need calcium, and the calcium is pulled from the blood and deposited into the bone. This is brought by thyroid calcitonin. At the same time, thyroid calcitonin also inhibits the absorption of calcium from gut. This way, calcium level can be brought down back to normal. But let's say the calcium level is lower than normal level. In that condition, it triggers your parathyroid gland to produce parathormone. Parathormone, it promotes osteoclastic activity, that is resorption of bone. And due to resorption of bone, bone gets broken down into calcium ions and phosphate ions, the hydroxyapatite part of the bone. And the calcium ion from the bone gets deposited into the blood. Parathormone also promotes absorption of calcium from your gut. However, vitamin D is required for the absorption of calcium. And this increases the level of calcium in the blood, bringing it back to normal. So this is the first concept that you need to know, the concept of bone remodeling. The second concept that you need to know is peak bone mass. So on the x-axis is the age and on the y-axis is bone mass. As you grow older in age, your bone mass increases as well. Till a point comes in your age when the bone mass becomes maximum. And this maximum bone mass is what we call peak bone mass. Usually at the age of 20 to 29, that is at young adult, at that particular time, your bone attains maximum mass or your bone attains peak bone mass. Now, the peak bone mass of a person is determined by various factors such as genetics, An African person tends to have a higher peak bone mass as compared to a Caucasian person. Second factor, nutrition. A person who has sufficient intake of vitamin D and calcium has a higher peak bone mass as compared to a person who is deficient of vitamin D and calcium. Number 3, strength training. Strength training leads to microfractures in your bone, and these microfractures, they heal. Once they heal, the bone, it grows greater in size, becomes stronger, and the peak bone mass increases as well. And finally, hormones. Hormones such as estrogen and androgen, they inhibit osteoclastic activity, or they inhibit resorption of bone. As a result, the peak bone mass increases. Now, here's the thing. Once peak bone mass is achieved, once peak bone mass is achieved, after that, as you grow older, you start losing bone mass by 0.7% per year. The reason being, as you grow older, your osteoblast becomes inactive. Osteoblastic activity decreases. However, osteoclastic activity remains the same. Osteoclasts still do their job. As a result, osteoclastic activity becomes greater than osteoblastic activity. Once osteoclastic activity becomes greater, that means resorption of bone becomes greater than formation of bone. So there is net breakdown of bone. As a result, the mass of the bone decreases. If the mass of the bone decreases to a greater limit, it increases the risk of osteoporosis. And this brings us to the topic, what is osteoporosis? Osteoporosis contains two parts, osteo, which means bone, and porosis, which means pores. So basically, pore formation in bone is osteoporosis. How does it happen? When osteoclastic activity becomes greater than osteoblastic activity due to some factor, the resorption of bone becomes greater than formation of bone. As a result, there is net resorption of bone, and the mass of the bone decreases. This is what we call osteopenia. If osteopenia worsens a lot, then it may lead to the formation of porous bone, and this is what we call osteoporosis. Once a bone gets osteoporosis, a bone becomes osteoporotic, it becomes very weak and fragile and increases the risk of osteoporotic fracture. A decrease in bone mass increases the risk of osteoporosis. So the factors that are responsible for decreasing bone mass are the same factors that are also responsible for increasing the risk of osteoporosis. And these factors are, number 1 is, once peak bone mass is achieved, as you grow older, you start losing bone mass by 0.7% per year. The reason being, your osteoblast cells, they become inactive. Osteoblast cells, they become irresponsive towards growth factors. As a result, osteoblastic activity decreases, but osteoclastic activity remains same. Overall, osteoclastic activity becomes greater than osteoblastic activity. That is, resorption of bone or breakdown of bone becomes greater than formation of new bone. As a result, there is decrease in mass of the bone, and this increases the risk of osteoporosis. If a person gets osteoporosis due to age-related problem, then that's your senile osteoporosis. So what is senile osteoporosis? Senile osteoporosis is the type of osteoporosis that is caused due to age-related problem. That is when the osteoblast cells become inactive and irresponsive towards growth factor, leading to higher osteoclastic activity as compared to osteoblastic activity, leading to higher resorption of bone as compared to formation of new bone. That's it. Second factor is reduced physical activity. Stress on the bone increases the density of the bone as well. Continuous stress on the bone and appropriate exercise will increase the mass of the bone. See, when you train your muscles, the size of the muscle increases. Similar concept is also applied for bones. So when you go through resistance training like weightlifting with progressive overload, what happens is that micro tears occur in your muscle. These micro tears, they heal up and the size of the muscle increases. Similarly, in bone also, microfractures occur. These microfractures, they heal up and the mass of the bone increases as well and the bone becomes stronger as well. That is why in athletes, the bone mass is greater as compared to a common man. So if you have an inactive lifestyle, or if you have a part of your body containing bone that is paralyzed, or if you are an astronaut away from earth in space under no under very less stress due to less gravitational force, in these cases, due to less stress on the bone, the density of the bone decreases and increases the risk of osteoporosis. That is why astronauts, after they come back to earth, they need physiotherapy. Third factor is genetic factor. So mutations in gene that code for Rankel or osteoprogerin might occur, which might lead to osteoporosis. What's Rankel? What's osteoprogerin? To that, you have to watch my video on bone remodeling. Next is serum calcium level and vitamin D intake. If the calcium level in your blood is below normal, then parathormone will be released by parathyroid gland, and the parathormone will result in resorption of bone, and this will end up resorption of bone will end up with hydroxyapatite being broken into calcium and phosphate ions, and the calcium ions from the bone will be extracted and added in the blood in order to increase the calcium level in the blood back to normal. And this is how bone mass decreases and increase the risk of osteoporosis. If you don't have enough vitamin D in your body, if you don't intake enough vitamin D, calcium won't be absorbed from the gut into the blood, and this also results in decreased level of calcium in your blood, and the same situation arises. Then there's hormonal influence. Hormones such as estrogen and androgen, they inhibit bone resorption. As a result, osteoclastic activity becomes less, and your bone mass is maintained. But let's say, for example, in case of women, after they hit menopause, the estrogen level, it falls down. As a result, osteoclastic activity increases, resorption of bone increases, and the bone has the tendency to become osteoporotic. This type of osteoporosis is called postmenopausal osteoporosis. So postmenopausal osteoporosis is the type of osteoporosis that occurs after menopause due to a decrease in level of estrogen. 6 is glucocorticoid drugs. Cause glucocorticoid drugs, they inhibit the absorption of calcium. As a result, there is decreased serum calcium level, and it brings us back to the previous situation. And then smoking and alcoholism, they are also risk factors for osteoporosis. So there are 7 risk factors, 7 risk factors. So what actually happens in a bone that is osteoporotic? There are 3 major things. See, your long bone contains your outer cortical bone and inner spongy bone. The cortical bone becomes thin. The Haversian canal that are present in the cortical bone gets dilated, and there is decreased number of trabeculae of spongy bone. Here's the spongy bone present in the inner side of the long bone, and here's the cortical bone. The cortical bone contains many Haversian canals. When the bone becomes osteoporotic, the cortical bone becomes thinner, the Haversian canal, they become wider, and the number of trabeculae, these branches are what we call trabeculae. The number of trabeculae in the spongy bone also decreases. All 3 reasons, they increase the risk of pathologic fracture or osteoporotic fracture. And there are 3 main types of osteoporotic fracture. Number 1, vertebral or compression fracture that occurs in vertebra that due to compression from 2 sides. There's your distal radius fracture. This is the radius bone, and this is the distal part of the radius bone, and there's the fracture in the distal part of the radius bone. These two types of osteoporotic fracture are caused usually in women suffering with postmenopausal osteoporosis. Then there's your femoral neck fracture. This is the femur, there's the neck of the femur, and there's the fracture at the neck of the femur. And this is usually seen in senile osteoporosis or osteoporosis due to age, old age. Diagnosis for osteoporosis. We use DEXA scan, that is dual energy X-ray absorptiometry. So DEXA scan is used to diagnose osteoporosis. How? DEXA scan is actually used to measure the density of bone. Once you have measured the density of the bone, you can compare the density with that of a normal person. And if the T score comes out to be less than or equals to minus 2.5, that means the bone is osteoporotic.